Okay, go ahead.
Okay, so our presentation is on professional organizations, and it's by Zachary Lovick, Sophie Soretz, Valeska Amaya, and Marissa Elms. So there are two types of organizations: professional organizations and advocacy organizations. The purpose of professional organizations are to enhance the credentials and careers of its members. There are many different professional organizations, and some are more geared towards specific careers, such as healthcare administrators, healthcare management, medical assistants, phlebotomy, pharmacy, surgical technicians, and more. So whatever organization you decide to join depends on what you're interested in. Here are some examples of professional organizations and their motives. The American College of Healthcare Executives is the leading professional organization for healthcare executives. Members of the ACHE are actively engaged and constantly looking for opportunities. The Healthcare Financial Management Association plays the role as the thought leader on top trends and the issues facing healthcare. This organization provides members access to trainings, conferences, seminars, certification opportunities, and more. The American Association of Healthcare Administration Management is an important connection to have if you are a healthcare management professional. The role of this organization is to provide education, advocacy, and networking. The American Health Information Management Association focuses on improving the delivery of the healthcare by ensuring management professions with the resources and knowledge they need. This organization differs from others because it focuses on change instead of standards of practice and care. The National Association of Healthcare Access Management is an organization that centers on maintaining high standards and establishing subject matter expertise among healthcare professionals. As a member of these organizations, you are given unique opportunities to grow and enhance your career. So establishing a membership in one of these organizations will provide you with significant connections. And the last thing I just wanted to mention was in the book, they mentioned two organizations that are involved in both professional and advocacy. So those are the American Medical Association and the American Nurses Association. So there you go.
I am going to cover the most significant professional organizations for healthcare administrators, healthcare financial managers, physicians, ambulatory surgery center administrators, and medical group practice administrators, and who they are. First, healthcare administrators. The National Healthcare Association is one of the largest certification and continuing education providers in the United States. It works with health training institutions, hospitals, unions, and U.S. Defense Department. The American Academy of Medical Administrators. It is an association of multidisciplinary healthcare management professionals at all levels within all types of health organizations. Next, healthcare financial managers. The American Association of Healthcare Administrative Management is the leading professional organization for healthcare administrative management. It provides information and education in areas of reimbursement, registration, data management, medical records, patient relations, and others. The American College of Healthcare Executives is an international professional society of 40,000 healthcare executives who leads hospitals, healthcare systems, and other health organizations. Now, professional organization for physicians. The American Medical Association is the largest association of physicians, both MDs and DOs, and also medical students in the United States. The Association of American Physicians and Surgeons is a membership-based physician organization that does not accept funding by corporations or government. Next, ambulatory surgery center administrators. The Ambulatory Surgery Center Association is a nonprofit association. It represents all aspects of the ambulatory surgery center industry. It includes physicians, nurses, administrative staff, and owners. The Ambulatory Surgical Center of America. It develops and manages ambulatory surgery centers throughout the United States. Finally, Medical Group Practice Administrators. The Medical Group Management Association is an association for professional administrators and leaders of medical group practices. It serves more than 22,000 members who lead almost 14,000 organizations nationwide. The Professional Association of Healthcare Office Management. It supports more than 3,000 solo physicians and small physician practices across the United States. Now, Marisa is going to talk about the benefit of these organizations and what to their members.
So as mentioned before, the purpose of a professional organization is to enhance the credentials and careers of its members, whether those members are recently graduated students or looking for their first job, or already established professionals looking for the next step up. Each of these professional organizations can help individuals to boost their careers by supplying education, resources, and certifications. Today I'm going to talk about 5 different organizations that affect the different aspects of healthcare as mentioned before. The first organization is the NHA, which focuses on healthcare administrators. The National Healthcare Association provides members with benefits such as education, certifications, and career advancement resources. Education credits are offered to help members stay up to date with revisions in healthcare information, and resources such as study materials and tutorial guides help members to prepare for certification exams. Job boards and networking developments allow members to reach out to others in the community who have similar training and experience. And the certifications provided by the establishment help to embellish their careers. Members can receive certifications in medical assisting, phlebotomy, medical administration, EKG technology, electronic health record specialties, billing and coding, and patient care. Many of these certifications can actually be used together to promote medical assisting and medical administration positions. The annual fee for this organization is $159 for the initial certification, and members can pay $40 for each additional certification that they wish to complete. The next organization is the American Association of Healthcare Administrative Management, which focuses on the financial managers of healthcare. This organization provides its members with education, advocacy, certifications, and professional networking. There are several chapters or local branches of members nationwide who provide current information regarding the local administrative developments happening around them. Job banks and career resources allow members to search for job opportunities and promotions, and each member receives a subscription to publicized journals regarding healthcare management. There is an annual conference held each fall for its members to further their understanding of administrative resources and tools in order to heighten their profession. The organization also provides individuals with an advocating voice in Washington, D.C., who is involved in congressional meetings and law changes. Members may also receive discounts on products and services such as credit cards, hotels, and rental cars, as provided by their local chapters. The annual membership fee for this association is $199. The AMA is an organization that focuses on physicians, residents, and medical students. The members receive opportunities to further their career, minimize their financial burdens, and expand upon their professional resources. Financial resources are available to help physicians, residents, and medical graduates to minimize their loan payments by offering scholarship information, providing financial discounts, and extending loan management opportunities. Job boards, volunteer options, and paid leadership roles provide individuals with greater career advancement resources, and professional publications keep members up to date on chronic illnesses, patient health advocacy, general health information, and health program campaigns. The annual cost for this membership is $420 for physicians. However, there are discounted rates offered for students and residents, some even as low as $40 a year. The Ambulatory Surgical Center of America is an organization that partners with ambulatory surgery centers to improve facility productions and increase profitability. It is a joint mission ran by an accumulation of physicians that aim to improve the ambulatory surgical center facility management, help to maintain facility costs, recruit surgeons, increase patient volume, manage scheduling, contract, and insurance conflicts, as well as eliminating financial debt and providing contract policies, procedures, and negotiations. This organization itself is certified and accredited, so combining efforts would provide other facilities with greater accreditation and credentials. The last professional organization that I'll talk about is the Professional Association of Healthcare Management. This association focuses its efforts on the medical group practice administrators and offers its members chapter enrollment, educational opportunities, and additional professional qualities to improve career aspects. Members with this organization can receive certifications as a medical manager or a health information technology manager. Some of the specialties within these credentials include billing and coding, handling medical records, compliance training, supplying medical equipment, monitoring changes in Medicare, and observing medical waste compliance. Annual conferences, seminars, webinars, and events are held to further the education and opportunities of members, and there are financial and professional resources that can help them to reach out in their career communities. The annual fee for this organization is $265.
We'll continue on by talking about some trade associations. What a trade association is, it's a body representing organizations within the same trade. It aims to protect collective interests, especially in negotiations with governments and labor unions. So really what this means in English, to give a quick example, there's the ABC parable. So if you have letters A to Z, each representing an organization, they can get together, make an association to try and figure out what they can do to make their industry of word making a little bit better. They decide they can all have a better impact on those that they're working with by making books or making songs. So in a nutshell, that's what a trade association is. And the first one I'd like to talk about is the Healthcare Supply Chain Association. The HSCA is a trade association that represents 14 purchasing organizations, which include for-profit and not-for-profit corporations, purchasing groups, associations, multi-hospital systems, and healthcare provider alliances. And below you can see some of the different organizations that are represented by the HSCA. The HSCA provides 5 main services to its members. They advocate with legislative and regulatory authorities. They provide educational opportunities to make the health industry more efficient. They also uphold the ethics of business practices within the industry. They provide opportunities to strengthen members' knowledge of healthcare, and they also act as a liaison to promote meaningful dialogue between health industry organizations. So just a quick example of what they do is this last year they came out with a report, their first annual report, and this one showed the value of group purchasing organizations to the healthcare industry. So they found out that GPOs reduce costs, that they save the industry $1.8 billion a year. They found out that GPOs increase competition and a number of other things. Next is the Healthcare Administrators Association. And their mission statement is to improve the quality, sustainability, and value of self-funding and healthcare benefit administration. So this is a nonprofit trade association aiming at supporting education, networking, resource, and advocacy needs of third-party administrators, insurance carriers, managing general underwriters, audit firms, medical managers, technology organizations, pharmacy benefit managers, brokers, agents, human resource managers, and healthcare consultants. So you can see that they represent a very broad spectrum of healthcare administrators. Just a quick example of what they're doing is this last week, they held a conference in Las Vegas with a focus on the disruptions coming to the industry. And so really they were looking at the new government situation about what's going on and how they might need to adjust some things. The next one is America's Health Insurance Plans, AHIP. They represent the health insurance community. They advocate for public policies to further the access of affordable health care coverage to all Americans through a competitive marketplace that nurtures choice, quality, and innovation. And so, quick example of what they're doing is Coming up in March, they are holding a national health policy conference. And so they're going to look at things such as the future of health reform, the view of top policy priorities, innovative ways to help modernize delivery systems. We're going to talk about preparing for potential impacts on the cost of care, as well as refining payment reform and managing high drug spending. The last one is the American Medical Group Association. And so this is a trade association representing medical groups, health systems, and other organized systems of care. Their purpose is to empower the delivery of coordinated, patient-centered, high-quality, value-driven healthcare. So a quick example of what they're doing is they have multiple initiatives that they're working on right now, and one of the more recent ones is a chronic care challenge initiative. And so this is a series of national campaigns dedicated to engaging healthcare systems, providers, patients, employers, and the rest of the nation in efforts to improve the management of specific chronic diseases. And so currently they're focusing in on type 2 diabetes. So this concludes our presentation on professional organizations and trade associations. Thank you very much for watching.
All right, awesome, great work, guys. Great job.